I hid my first period from my mom for 1 year because I was afraid. I thought that they would think I've slept with a man because blood was coming. And there was always a saying that when you sleep with a man, your virginity is broken, blood will come.
As a male child in my community, seeing girls dropping out of school at the onset of menstruation
came from the challenges that I saw within the community, particularly when I would see girls actually missing out on school during their periods. And then you come across cases of girls having low self-esteem because they did not have a product to use when they were going through their menstruation.
I discovered that 60% of households were not able to buy single-use pads, like monthly. So most of them opted for other alternatives like clothing. Innovating the reusable pad was really a game changer.
We're leaving out a section of women, those that are 10 kilometers away, those that are 15 kilometers away, but also those living with disabilities who are really unable to move all the way to where our physical shop is. So we thought of bringing the products to their doorstep, and that's how we thought of getting a tuk-tuk and making it a mobile shop.
We have a revolutionary technology called Dignify, which is the first of its kind that allows registered users to make flexible savings, specifically towards purchase of menstrual health products.
Realizing that men were greatest players and they were the biggest contributors to the stigma, we became very intentional at organizing sessions to include men.
We also involve parents who are male because they buy, okay? We involve husbands because they're the ones who give their wives money, and we have all dialogue together. That way we're able to, break and demystify the stigma.
We do not work alone. We work together with the local government, the county government, the teachers, the parents. So anytime we are sharing this information with them, then also it informs what goes on into them refining the policy or just making the policy more inclusive.
The number of girls completing has actually doubled than it was about 10 years ago, completing their primary school level. And that is not just in one school, it's now across the district where our efforts have been.
We've distributed over 12,800 period products. This means for us, it's not just the numbers of pads. This means that that girl who needed that pad has it, and they're going through their menstruation when they have their sense of dignity.
Well, I see that, and from my experience, there's a big potential. It's an area that especially young people could tap into and get involved in the distribution chain of these products. Not only menstrual pads, but female health and hygiene commodities. The demand is there, the women are waiting for these products in the communities. What is lacking is who is bringing it to them.
My dream is so big. I am from Africa. I want to have social enterprises of Wabibi everywhere in Africa.
What scale looks like for us, one is expanding to serve more regions across Kenya, and then eventually Uganda, East Africa, and then across Africa.